A hearty welcome to my channel, Kunjapan Sebastian. Our topic for today is osteoarthritis. Osteoarthritis is a degenerative bone joint disease and is the most common form of arthritis. It affects millions of people worldwide and it is not curable but manageable. Before proceeding further, may I request my viewers to kindly watch the video completely and like and subscribe to my channel, and it shall be highly appreciated. Every bone joint has a protective coating known as cartilage. The cartilage cushions the ends of the bones of the joint. It acts as a shock absorber, lubricant, and enables the joint to function frictionless. Even though cartilage is a tough and hardy tissue, it is a wear and tear tissue. Therefore, over time, by repeated and prolonged use of the joints, combined with other risk factors, the cartilage gets worn out progressively, resulting in the disease. In certain cases, the cartilage may get worn out completely, resulting in the bones of the joint touching each other. This may cause a grating sensation to the patient, and he may hear a cracking sound when the bones rub each other. Added to the wear and tear of the cartilage, arthritis affects the entire joint, especially the connective tissues that hold the joint together, causing inflammation and pain. The affected joints are those of hands, knees, hip, and spine. Symptoms of the disease progressively deteriorate over time. Apart from pain and inflammation, stiffness and tenderness of the joints are other symptoms. The debilitating symptoms of arthritis are loss of flexibility and mobility as the patient finds his joints stiff, painful, and rigid, and restrict him in using the joints to their full range of motion. Now let us consider the risk factors of the disease. It is hereditary in nature, meaning that if you have a family history of the disease, you are more likely to get it. Also, when your muscles are weak, they do not support the joints adequately, resulting in poor alignment of the joints and subsequent development of the disease. Babies born with malformed joints or congenital deformity of the joints are prone to this disease. Injuries to the joints while engaged in impact sports or during accidents may develop this disease. If your job or the sports you play demands stressful and repetitive use of certain joints, those joints are likely to develop arthritis. Age is another risk factor, as those who are above 50 years or more are prone to this disease, meaning senior citizens. For example, yet another factor is sex, as more women are infected by arthritis. Those who are obese, having a body mass index (BMI) more than the normal 25 are more likely to get arthritis, as the weight-bearing joints like hip and knee joints are constantly under stress. Again, diseases like diabetes, heart, lung, and liver diseases are also act as risk factors. Now let us see how the disease is diagnosed. As disease progresses slowly and gradually, it is difficult to detect the disease in the initial stages. Those who are facing a risk factor are required to undergo diagnostic tests, as early detection and treatment may slow down further deterioration of the joints, particularly cartilage and soft tissues. Tests include a physical examination of joints and X-rays to take images of your joints. Magnetic resonance imaging (MRI) is said to be a very sensitive test for arthritis, as it reveals subtle changes in the joints like edema, inflammation of soft connective tissues, and deterioration of cartilage. Osteoarthritis is a degenerative and progressive disease and over time, the symptoms like joint pain, stiffness, lack of flexibility and mobility, and painful sleepless nights may become severe and lead the patient to a depressive mood, calling for appropriate treatment to ameliorate the sufferings. In the treatment of arthritis, physiotherapy plays an important role by strengthening the muscles around the joints, by exercising, improving the flexibility and mobility, and reducing the pain. Doctors may prescribe medications for pain and inflammation, as obesity is reported to be one of the leading causes of arthritis. Reducing body mass index below 25 is advisable. When a joint is severely damaged by arthritis, surgery may be required by which some of the defective parts are removed and replaced by parts made of metal, ceramic, or plastic. When the damage is beyond repair, total joint replacement is required and is called arthroplasty. As an acknowledgement that this presentation is useful, kindly like and subscribe to my channel, and it shall be highly appreciated. Thanks for watching. Bye till we meet again with yet another episode.